So I'm going to talk now about the concept of negative versus positive pressure ventilation. So let me draw a little picture here for you. This is kind of how our chest is. So this is going to be our chest. There's our neck. Here's the patient's mouth. Trachea. Trachea. And here are the lungs. I'm going to draw it kind of simplistically here. So those are the lungs. This here is the patient's diaphragm. It's the big muscle that goes kind of under the rib cage, and it's responsible for helping with breathing. So this is closed off here because that would be our head. Really, it's our head that comes up here. And the only opening is our mouth and our nose. It's kind of the same thing. Whoops, it's a funky looking nose there. So air is going to go in through the mouth and nose. Well, how does this actually happen? Well, what happens is that our diaphragm constricts and it actually pulls down. So the diaphragm moves down here. And you've got these nice strong ribs, and these ribs help keep this chest from collapsing, because normally if you've got a closed box like this, think of it maybe as like a bottle or something, and you try and pull the bottom down, it would collapse in the sides. But we can't do that. The rib cage helps to keep the chest stiff so that it doesn't collapse. So what happens instead is we create a bigger space. And in the process of creating that bigger space, we actually create a decrease in intrathoracic pressure. And when you have a lower pressure on the inside of the chest than you do on the outside, air is going to move in through the mouth and into the lungs and fill those lungs up. So you have a negative pressure. It's called negative because it's lower than the pressure on the outside of the chest. So this is the normal process. This is how it normally works, is you have a negative pressure. The cool thing about this is not only does it help the lungs, but there's our heart kind of tucked in there too. This negative pressure process that pulls air into the lungs also draws blood into the heart, which helps to increase our cardiac output. So cardiac output is CO. So we increase our cardiac output with this negative pressure, and that's really a good thing. It helps our heart, it helps our lungs, and it's good. So I did talk about breathing out. So basically the diaphragm relaxes, it creates a smaller space inside the chest, and so air naturally moves out. Now, when somebody's unconscious or not breathing, we actually use positive pressure to squeeze air in. We put that big old mask over their face, and it's attached to that big old ball looking thing that we squeeze down, and it forces air into their chest. This is positive pressure. So positive pressure is placed by external devices, usually a BVM in our case. In this case, venous return to the heart is reduced, so you're actually squishing the heart. Instead of pulling blood into the heart, you're squishing the heart, and so blood doesn't come into the heart as well. So you have a decrease in cardiac output. At the same time, you're squeezing the bag, the air will go into the trachea, but remember there's two tubes that leave from the mouth. You've got the food tube, or the esophagus, as well as the trachea. Oops, esophagus and the trachea, right? So this one goes down into your stomach, and this one, you know, there's your little Adam's apple, goes down into your lungs. Your mouth would be over here. So you squeeze the air in, it's going to go into both tubes. So the problem with that is that air is pushed into the stomach. I'm going to move to the next slide and talk about why that's a problem. So when you push air into the stomach, that leads to what's called gastric distension. So gastric distension, I want you right now to imagine that the stomach is like a small balloon. And when you eat, normally that balloon can stretch a little bit, and it's not a big deal. You can kind of put some stuff into the balloon, and it's not going to stretch and squeeze too much. But now you take and you really expand that stomach so it's really big and full of air, because we're squeezing too much air in. And there's some delightful stomach contents. You know, there's your piece of pizza that you ate, and your ice cream cone over here, and all that's in the stomach. All right, my little stomach drawing disappeared. Let me see if I can I can draw this again. All right, so we had our big stomach that's full of delightful food stuff, and we're forcing a bunch of air into it. So we're using, basically taking and stretching this, and we have pressure increased on the stomach. So a lot of pressure outward on the stomach. Well, you know what the stomach does? It gets angry and it squeezes back. And it squeezes in, and then all of this food, all that pizza and ice cream, that comes right back up the esophagus and out the mouth. Well, that is a problem, especially if your patient is unconscious and can't manage their airway. So we have to be very careful to ventilate at the correct rate and volume. We want to prevent over ventilation. So remember, over means, well, I drew the down arrow, but really it means too much, of course. So too much ventilation. Not only do you get this gastric distension that leads to vomiting, but you can end up with hypotension. Like I just mentioned, when you're using positive pressure ventilation, you are decreasing cardiac output because you don't have that negative pressure to help draw that blood back into the heart. So overventilation leads to hypotension and gastric distension, and both of those are very bad things, and it'll make your patient very sad. So we want to ventilate at the correct rate for the patient and the correct volume. The correct volume is going to be just until we see the chest rise. All right. So I'm going to take a break at this point. In the next section of this lecture, I'm going to come back and talk about methods of ventilation. So how actually can we ventilate our patient?